In this video, we will look at the radiological features of rickets. To start off with a few questions, the first question is, what is known as the cupping of metaphysis? What exactly happens in the cupping of metaphysis? Second one is, in widening of the growth plate, what is happening? Why does the growth plate widen? The third question is, name all the features, radiological features in the rickets, just the heading. So we'll find out the answers to all these questions in this video. And there are some questions for the viewers and it has to be answered in the comments. It is there in the end of the video. So first, starting with the radiological features, it includes the loss of the proximal zone of calcification. And the earliest, this is nothing but, this is the earliest radiological finding. It is the earliest radiological finding. And it is nothing but a finding of the rickets. And next, there is a delayed appearance of the epiphysis. Next, there is widening. There is widening of the growth plate. So what is the normal growth plate size? Normal growth plate size is about 2 to 4 mm. So it increased in the case of the rickets. And what is this due to? This is due to the excessive accumulation of the uncalcified osteoid at the growth plate. Then we also have the cupping of the metaphysis. So what is meant by the cupping of metaphysis? The cupping of metaphysis means that there is that is firstly the normal metaphysis, it meets at the epiphysis. The normal metaphysis, it meets at the epiphysis, and there is a smooth line of sclerosis. There is a smooth line of sclerosis. And in rickets, this line is absent. Line is absent in case of rickets. And the metaphyseal end appears irregular. So here the metaphyseal end appears irregular. And the cartilage accumulating in the growth plate creates, so the cartilage which appears in the growth plate, this creates a depression in the metaphysis. So it creates a depression in the metaphysis, and this causes cupping. Next, what we see is fraying. So what is meant by fraying? In fraying, there is indistinct margins of the metaphysis. Indistinct margins of the metaphysis. Then there are also some other points, such as there is bowing of diaphysis. Bowing of the diaphysis, and this is with the thinning of the cortices. Next, there is also healing. There is healing rickets. This is nothing but a zone of the calcification. They become denser. So all these features are very prominent where the growth is the maximum. So some prominent regions in the body, they include knee, that is the distal femur, and the proximal tibia. Then there is also the wrist, that is especially the ulna, and also the anterior ribs. So this is the rachitic rosary. So now we are going to answer the questions we asked in this initial part of the video. So the first question we asked was, what is the cupping of metaphysis? Cupping of the metaphysis. So the cupping of metaphysis. So firstly, we need to know what is a normal metaphysis. So normally, the metaphysis, it meets the epiphysis. The metaphysis, it meets the epiphysis as a smooth line of sclerosis. So there's a smooth line of the sclerosis. And in rickets, what we see is in rickets, the line is absent. This line is absent. And the metaphyseal end, the metaphyseal end, what happens is this metaphyseal end, it appears irregular. It appears irregular, and the cartilage accumulates in the growth plate. So the cartilage, it accumulates in the growth plate. So this creates a depression in the metaphysis. So it creates a depression in the metaphysis. So this leads to the cupping. So just to repeat, there is a normally the metaphysis and the epiphysis, there is a smooth line of sclerosis. So in case of the rickets, what is happening is this line is totally, it is absent, and the metaphyseal ends, they appear irregular, and the cartilage, it appears, the cartilage there is increased in case of the, it accumulates in the growth plate, and this creates a depression in the metaphysis, and this causes the cupping. So now looking at the next question. The next question we asked was, what is the widening of growth plate? So in case of widening of growth plate, we need to know that the normal width of the growth plate is nothing but 2 to 4 mm. The next question is that what are the features of, but before that we'll learn a lot more about widening. So the widening, it is normally it is 2 to 4 mm, and it is increased in case of the rickets. And this is due to the excessive accumulation of the uncalcified osteoid at the growth plate. So this has to be known. So now we are just jumping to this question. As the third question, we are just asking some of the features of the rickets, just the headings. So the features, it includes, firstly, what we saw is there's a loss of the provisional zone of the calcification. Next, there is a delayed appearance. There is delayed appearance of the epiphysis. Next, the growth plate, it widens. So there is widening of the growth plate. And later, there is also the cupping of the metaphysis. Then there is fraying. Next, there is also the bowing of the diaphysis. Lastly, then healing rickets, we need to know that the zone of calcification, it becomes denser. And we also saw some of the prominent zones. So it is the knee, that's the distal femur proximal tibia, wrist, that is especially the ulna, as well as the anterior ribs form of rachitic rosary. So now there are some questions to be answered in the comments. So the first question is, what is the earliest radiological finding in rickets? So what is the earliest radiological finding? As a radiological finding in rickets. The next question is, what is fraying? The last question is, What are some prominent locations, the prominent areas or location where rickets is prominent? So these answers can be given in the comments.